So we can start now. Yes, we can start now. I'll just quickly introduce myself. My name is Pratusha Chatterjee. I am a psychologist working in the field for the past 14 years. My expertise lie in therapy interventions. Okay. I am working with a lot of people. I work with kids. I'm a senior psychologist in panel of schools. I work with corporates. I'm a senior psychologist with corporate doctor panels where they need to have one mental health professional on board. I am also working with psycho-oncology, doing a lot of research with individuals with cancer and psychological assistance that need to be provided to them. I am a hypnotherapist. I've completed my levels of hypnotherapy, CBT, TA, or quite a few things. I don't want to go into a lot of details. And with ICS, I take courses. One of my favorite thing to teach is psychotherapy, like a lot of therapy, how you deal with people, right? So that is something that's one of the most degree. Okay, Neeraj, yes, I'll come to that. I would love for everyone to put their videos on if it is possible. For people who can, it'll be nice. So a psychologist, so basically you need to have your master's to become a psychologist, and currently it says a full-time master's more. Okay, the distance like is a little more in question. But what I have seen is that all of the trainings that we do, even the online trainings that we do, they really add to our skills. Okay, so and we have a lot of turmoil going on in the field, if people are aware, with the RCI registration, with the clinical psychology degree changing, and people getting upset and so many things happening. But if you really are looking at becoming a psychologist, I would really, really encourage you to do your master's. If you feel that I am okay being a counselor and a guidance person, then I would encourage for you to do diplomas, okay, in various training programs. Okay, different training programs. Okay, it is very important for a psychologist to get trained in different modalities. Okay, different modalities. We have beautiful modalities in psychology. Some are very different from the other, but however, all of them are connected. And when you look at an eclectic approach, what does an eclectic approach mean? Where you have trained yourself into multiple therapy modalities, and when you have a person in front of you, then you take certain techniques from here, you take certain techniques from here, and then prepare an intervention, design an intervention which is the best for the client. Okay, so I am an eclectic person. Some people are not, and that is absolutely fine. It's a choice. So, for example, if you are a CBT, cognitive behavioral therapist, and that is what you want to stick to, there is absolutely no problem with that. Okay, if you feel you want to combine that with behavior therapy, with mindfulness or whatever, absolutely no problem with that. Whatever works for you, but most importantly, what works for the client, right? So we have to design therapies for clients. Okay, keeping in mind a lot of things like how to form goals. Okay, what are the things that need to be done? All of these things are taught basically in the psychotherapy course, in the CBT course, in the practical internship. All of these things are there. So I will not go into a lot of detail over there. We will do a quick introduction. Okay, 2 lines. What is the field that you're coming from? If you're coming from the field of psychology, just tell me in a line or two, what are you doing? Okay. And why are you here? What is it that you're looking at learning? Is that okay with everyone? So let me start with Madhuri. Would you go first? Yes, please go ahead. We can't hear you. We're not able to hear you. Not able to hear you. Not able to hear you. I think you should just check your settings, thoda sa.
Can you hear me now?
Yes, we can hear you. Hota hai kabhi your phones ke that happens. Yes, please go ahead.
Yeah. Hi, good evening. I'm Madhuri, and I come from the services background. So I've been into the counseling field for almost 30 years,
Oh my God, that's
basically dealing
amazing.
with women and welfare of women. And during the course, I've also been associated with special children and with cancer patients and caregivers. But I don't have uh, any certification as such. So I've enrolled for a diploma in counseling, so that the landscape of experience that I have, I can get a stamp of it. And in the meantime, while I'm finishing that course, I thought I'll add on to whatever I can get more knowledge on. So that's how I enrolled on this course as well. Thank you.
Oh,
looking forward.
Thank you, Marjorie, for being in the field for 30 years. It's amazing. It's amazing. You know, we need more people in the field. Yeah. We really, really need more. Thank you so much.
Thanks. Thanks for your kind words.
Absolutely. It's just, you know what it is. So let's go with Samriddhi.
Hello, ma'am. Am I audible?
Yes, you're right.
हेलो आई एम समृद्धि मैं प्रोफेसर हूँ एक्चुअली ज्योग्राफी सब्जेक्ट से और ग्रेजुएशन में मेरे पास साइकोलॉजी था तो आफ्टर मींस कोरोना में मैंने नोटिस करा था कि बहुत डिप्रेशन फैमिलीज में था, बहुत ज्यादा सुसाइडल केसेस हुए थे, बहुत ज्यादा मतलब डिप्रेशन लेवल का जो लेवल है डिप्रेशन का वो इतना ज्यादा हो गया था कि एवरीबडी नीड सम काउंसलिंग्स एंड सम ट्रीटमेंट। और मेरे पास साइकोलॉजी तो था ही, तो मुझे लगा कि नहीं, मुझे आगे ज्वाइन जरूर करना चाहिए।
फोन करा
तो इसीलिए मैं इसको आगे करा। मेरे को जब पता चला कि ऐसे मैं बहुत टाइम से सर्च भी कर रही थी कि डिप्लोमा है, कोई काउंसलिंग का सर्टिफिकेट होता है, कुछ होता है, तो मैंने देखा बहुत सारे कोर्सेज तो हैं ऑलरेडी जैसे उडेमी पे, और लेकिन वो वन डे का एक सर्टिफिकेशन देते हैं, तो मेरे को लग रहा था कि यार ये तो वेस्ट ऑफ मनी, और आपका मतलब जो आपके अंदर जो स्किल है वो वैसा हो ही नहीं रहा है। तो डेफिनेटली आई नीड टू इम्प्रूव माई सेल्फ फॉर सच काउंसलिंग। वर्ड जो प्रॉपर वर्ड है वो काउंसलिंग का वो यही कि आप नेक्स्ट टू पर्सन कैसे आप कर सकते हो, तो इसलिए मेरे को ये चाहिए था। सो आई जॉइन दिस वन।
Yes, Miss Sarga, can you tell me 2 lines what brings you here?
Okay, ma'am. So I am an actually IT dropout. I am working in HR field. So actually this course was suggested by my therapist only. And since I was yes, I was really interested in psychology. I was very grabbing concepts very fast. So she suggested me that you can do this. So that's how I am here.
Great, excellent. And see, because you have been through therapy, no, once you do the course, you will understand what to do with the client so much better than so many other people. So much better than so many other people. Trust me about it. Okay, this is an advice that I give to everybody. If you have not been through therapy, please go through therapy. Okay, break the stigma with your own self first, and then when you start to break the stigma with your own self, it becomes so relatable. You can relate to the things that are happening to the client. Okay, yes, it's very nice of you, Miss. It's very nice. Welcome to the field. Welcome to the field.
Thank you.
Khushbu, would you like to go next? Cannot hear. You need to unmute yourself. Okay. She'll rejoin probably. Raj, would you like to go next?
Ma'am, should I continue now? It's fine.
Okay, continue.
Am I audible?
Yes, you're audible.
Yeah, so my name is Khushbu and I'm a teacher currently in primary section, and I'm already pursuing child psychology from ICS. Oh yeah.
Wonderful.
So I'm looking forward all the time for the free webinars to, grasp more knowledge about the field. And I'm already working with children. So I think this is an interesting field because we deal with parents and children, back to back in PTA and children to every day. So that is the reason I have opted for this course.
Beautiful, beautiful. Thank you so much for working with kids. Thank you so much. Yes, Raj, would you like to go next?
Yeah. Hello, my name is Raj, and I'm a yoga teacher and a fitness trainer. So, being a yoga teacher, there are many people who, yoga people join yoga when they have some disease, some mental or physical issues. Otherwise, people don't join yoga. This is the mindset of people. Like people, I don't have any
And
problem.
that
I
is
should do yoga.
so sad, no? That is so sad. Matlab,
Yeah,
I
but
wish more people
nowadays I see many fit people also do yoga because they don't want, prevention is better than cure. So, but lately, last 2, 3 years, I've seen so many people, now these anxiety and stress, depression cases has been increased. And since so many years, I have been training people who are in anxiety and depression. They have been to psychologists, psychiatrists, and so many other medicines they have taken. But with yoga, I have seen there are some pranayam and meditation, some calming exercises are there, breathing techniques are there. Those things helps to, you know, if I go into medical terms, then the parasympathetic nervous system activates, and then sympathetic we deactivate, and so many
Correct.
different stress hormones,
Yes,
catecholamines. So
yes,
these
yes,
things helps when you do there are some breathing techniques. So
Mhm.
that helps to reduce these adrenaline, epinephrine, these cortisol levels.
Correct, correct,
So I don't
correct.
want to go into much in this.
I
So
can
the thing
understand that.
is, c- uh, try to counsel also and do with the yoga therapy. I help them to become fit and live their happy life. But I
Very
didn't
true,
have
very true.
any this kind of certification in this this thing
Come.
counseling. So I wanted to. Even I was searching for a few years and months. I
Right,
did not find and did not find the time to do this. So now I
correct,
found it. So I thought today Aisha told me you have this webinar. So I thought
correct.
let me join
Why
and
not?
yeah.
Thank
So
you so much.
yeah.
In the course that we finished yesterday, there was we had the ambassador of the wife of the ambassador of Zimbabwe, name some some African place. I'm so sorry, I forgot the name. And she's become a fan of yoga from the time she's come to India. She's become such a fan of yoga, and she's enjoying it like anything. Okay, it's a very wonderful modality of physical
Mhm.
and mental health. Thank you so much, Raj, for doing that work,
Thank you.
being
Thank
here.
you so much.
Thank you.
I'm looking
Uh,
forward.
yes. Varsha, would you like to go next? Wonderful
Hello.
painting, by the way. It's the real painting, right? It's a real
Yes.
painting. Yes, yes, it's
Thank
not a beautiful painting. Beautiful.
Good evening. Yeah, so I am Varsha. I was a homemaker and lately I have joined my husband's work.
Mhm.
I go to office for some couple of hours, but I don't feel satisfaction there. From a very long time, I was having this in my mind that I want to do something for the people. There was a time, say 20 years ago, I had got into depression for certain reasons. And maybe I couldn't search someone for myself. I did visit a doctor and I was prescribed some medicines. But then there was no one with whom I could share what I was going through. So from that time itself, I had this in my mind that I must do something for others.
Right.
And that thought kept growing in my mind, but I never got an opportunity to go ahead with it. So
Right.
now I feel I should do something. I should be uh, like I should be a helping ear.
Correct. Correct.
I should give some solutions. I do a bit of counseling in my level, like with
Correct.
people around me. Whenever I see someone in trouble or hurt, but I want to go ahead with it with a degree.
Okay.
That, so
Okay.
I'm looking
Samriddhi,
to join.
It'll take a little while. 10, I think 10 तो बजेगा, 10, around 10 minutes ऊपर हो सकता. Okay, so sorry, Varsha, I interrupted you. I just had to answer her question. Thank you so much,
Yeah.
Varsha. And I know if you have faced depression, if you have faced all of those things, you know how that feels. You know, it's getting up in the morning, doing
Yes.
things with depression. It's not easy. People feel कि क्या ही है आपको, कुछ दिख तो नहीं रहा है. People don't understand. Like, you know,
Yeah.
just because physically there is nothing wrong, they feel okay, what is it? And if somebody has gone through that, hats off, you've gone through that and you're doing well in life. Always appreciate that. Okay, so I would love to talk with everyone right now, but I just realized we will be running out of time. I will have to complete the PPT, the topic for the day, and then I will come back to all of the introductions. Is that okay with everyone? I hope that is okay with everyone. Okay.
Yes, ma'am.
So what we will do, what are we going to talk about today? We are going to talk about something very, very sensitive. The unspoken needs in counseling. Okay. We all have unspoken needs, and our unspoken needs sometimes are so loud. Okay. I hope you understand what I mean. These are unspoken, but they are so loud in our own heads and in our life and in the way they affect our life. They affect our work, they affect our relationships, and all of it. So the client sitting in front of us will always have a lot of unspoken, unfinished. Okay, they have needs, they have certain things that they are going through, and they're not able to understand exactly what is going. So we are going to take up this very sensitive space of unspoken needs. Now, everything that I'm going to do in the PPT, like I do in my courses, it is a session for you. You take it as a counseling session for yourself, because everything that you learn has to be applied on the self first. Has to be applied on the self first. If you do not apply it on yourself, you will not be able to do it for the client. Remember this. Okay, you're not just learning a technique, you're learning the application of the technique. And the first application needs to come from the self. Okay, just give me one moment. I'll just share the PPT with you guys and we will get started. Okay, just give me one moment.
What is going on, Madhuri ma'am?
No, I think the PPT is yet to start.
Okay.
Are you able to see now? 1 minute, something's.
No, ma'am.
I am okay. Yes. Now can you see?
Yes, ma'am.
Yes, ma'am.
Okay. So sorry about this. कभी कभी होता है थोड़ा सा technical. Okay. So now, what are unspoken needs? We need to understand that unspoken needs can be so many different ways. It can be a child actually in front of you, and the child not able to tell you exactly what the child is feeling, or a woman in front of you, okay, where she's going through so many things, and you might know the incidents that okay, she's going through this. You might know the incident of the child that he's going through this, but it becomes so difficult for them to express. Okay, so here we have to help them express what they are feeling. But we will be able to help them express what they are feeling when we are able to gauge what they are feeling. Okay, so how do we gauge what they are feeling? The first thing that we understand is the emotional need connection wheel. Okay, now if you can see in the wheel, there are certain emotions present over there. And these are the basic emotions that go unidentified. Okay, and these are the emotions that the person is trying to express, but the person does not understand how to express. The first thing that the person is trying to express in so many different ways is fear. Okay, a person who is very, very angry, throwing a temper tantrum, okay, doing so much of aggression, bringing out so much of aggression. People feel that, oh, this person is very aggressive. Oh, this person is this. Oh, this person is that. But there are so many times when you sit with this person for a very long time and then you realize that all of this aggression, all of this violence is coming from fear. The person is basically feeling so insecure and does not really know what to do. So the person creates a wall, okay, and this wall to keep himself or herself safe. And the fear can get translated into aggressive behavior so many times, okay, and it goes unnoticed so many times. So the first thing that we do is we help the client understand that there are so many different types of feelings. Okay, maximum people will know 2 3 feeling words. I'm feeling depressed. Now that is a very common word to use, that I'm feeling depressed. Always encourage people to not use the word depressed but use the word sad. Somehow people have forgotten to use the word sad and they keep using the word depressed. Depression is a technical word, it is a diagnosis. Depression is not a feeling. Okay, depression is a diagnosis that is given by a mental health professional, basically a psychiatrist or a psychologist, to the person to understand what is happening with the person. Depression is not a feeling, it is a state. Okay, the word to use for the feeling is sadness. When sadness becomes intensified, we become depressed, right? So we have to help people first understand the feeling and pinpoint feelings. So they on Google you will find wheels and wheels of emotion expressions. So there are so many different words. They will say that I am angry, but they're not angry, they are jealous. They will say that I am feeling very anxious, but they're not feeling anxious, they're actually insecure. So they don't even know the different forms of feelings that exist. So what I do is I sit with them with the feeling chart. Okay, then I take the situation that they are talking about. Then when we look at the feeling chart, we talk about different feelings, and then we talk about what kind of feeling is more connected to the kind of situation that the person is facing. Okay, that is the first thing. Make your client familiar with the range of emotions for them to identify what they are feeling. And when they are identifying what they are feeling, then it is not unspoken anymore. Then they can put it in words. Okay. Help the client observe and identify. So if you have done CBT or if you have done psychotherapy, you will understand that there are so many different ways of identifying feelings and observing feelings. One of the most common way to do is a thought monitoring worksheet. Make a note of it, everybody. Thought monitoring worksheet. If you do a thought monitoring worksheet, the client is able to identify the thought, the feeling that is followed by the thought, and the reaction because of the feeling. So, say for example, if the thought is one particular situation occurs, and if the thought is, how can this person do this to me? The feeling is going to be anger, hatred, disappointment, sadness, all of that. And the behavior is going to reflect all of these feelings. Okay. Sometimes people don't know why they are behaving in the way that they are behaving because they have not identified the feeling behind. They have not identified the thought. Help them observe and identify what is the thought and what is the feeling. So there can be a lot of grief behind anger. There can be a lot of fear behind a scared child. So a child who's facing a lot of punishment, corporal punishment, a lot of beating up, a lot of abuse at home, is obviously going to come to school and bully others or will go into social isolation. Okay. Here, the child does not know what's happening with him. Okay. The child doesn't even know how to put it in words. It's a very unspoken thing. When you sit in front of a client and you look into their eyes and you know that there is something happening which they are not able to put into words. So look out for these emotions: fear, sadness, guilt, anger, rejection, and disgust. Okay, look out for these feelings. Look out for statements. Look out for places where you can identify this, and then go slowly deeper into, okay, the fear of what? What is happening over here? Sadness, from where is this coming exactly? Anger, where is this coming? Is there layers of feelings, or is there just one feeling that we are working with? Okay. The next thing that we have to do is awareness for the self. So I want you to do this with your own self. Okay. I think if ICS is going to share the PPT, or if you can just understand the questions, these are the questions that you will have to do with your clients. Some basic questions I'm giving. Okay. And then from the basic questions, we can go deeper. So the questions need to cover 4 areas. One is your emotional area, one is the physical aspect, the social aspect, and the personal aspect. Okay. When you practice identifying your own unspoken needs, okay, you are in tune with the client's needs also. If you're asking questions to yourself again and again and again, okay, then asking question becomes a reflex. Okay, it does not require a lot of work. Initially it requires a lot of work. Initially you have to train yourself to ask questions, if you are in a difficult situation, you'll have to train yourself to ask questions, but you do it for a little while. You do it for 2-3 months, then you will see your mind coming up with questions, helping you identify what is happening. You will be able to see what are the unspoken needs that you have, which you have not able to pinpoint. And if you are able to pinpoint those, then you will be able to do it with your clients as well. And one of the basic things is observe people around you. You are in a train, observe people. Okay, observe. You are waiting in a waiting room, okay, of a doctor or wherever. Observe people. Do not always stay inside your own head. Okay. Observing others, observing situations, they give us a lot of clarity because they They bring us in the present moment. And when you are in the present moment, you get a lot of clarity. So what are the type of questions that you're supposed to ask yourself? Okay. Now here, emotional questions, very basic questions. What am I feeling? Identifying the feeling. Then identifying the cause. Okay, I'm feeling like this. Let me be truthful with myself. What is causing these feelings? Okay, where is this coming from? And do not judge yourself, whatever be the answer. Non-judgment towards the self needs to be practiced. Once you practice non-judgment towards yourself, you'll be able to practice non-judgment towards your clients. Okay, are all of these feelings coming from? Is this an embarrassing, shameful situation for me? Okay, is there another way I can view this situation? Okay, what happened? Where did this? What just happened? Can you all see the PPT?
No, ma'am.
अरे यार, just 1 minute. Can you all see the PPT now?
Yes, ma'am.
Okay. I'm so sorry. I think my device is glitching a little bit. Yeah. So, what is another way of dealing or viewing the situation? The situation that I'm looking at, I am looking at it from only one perspective. And if I am in an intense emotional state, trust me, then I am actually not able to see the situation clearly. Okay. I have to understand that there is always a different way of looking at this. There's always a different way of looking at this particular situation. So one way to help myself is taking a step back. Okay, clicking the pause button, taking up a journal, writing things out. What is exactly happening? Then I can see the situation better. I can get clarity over the situation. And the next important question to ask is, how can I cope with all of these emotions in a healthy fashion? Okay, so feeling really angry, let me go for a walk. I'm feeling very, very upset with someone. Let me have a conversation with my best friend. Okay, I'm feeling very confused. I'm not feeling in the right space. Let me just take rest for a day. Let me give myself some break. Okay, so you will have to look at healthy ways of coping with emotions for your own self first. If you do that for your own self, then you will be able to introduce it for your clients. Being aware of what you are feeling physically is also important. Simple things like when I'm hungry, thirsty, sleepy, okay, when I'm uncomfortable. Am I physically uncomfortable in the presence of another person? Am I in some kind of pain? Okay, is there something lacking physically? Am I not getting enough sleep? Am I not getting enough exercise and sunlight? Of course, when it comes to sunlight, I also feel I need it a little bit more these days. Exercise also. Now, if I am aware of it, at least, if I'm aware of it, I can do something about it. I can keep trying to bring a change till the time I am able to. And it is okay if you're not able to. Don't blame yourself. Don't judge yourself. We are living in a very, very fast-paced world. We have 10,000 different things to do. So it is not easy to do all of these things. But we should not stop trying. Okay, we should not stop trying. The next aspect of our life is the social aspect. Okay, relationships play a very, very important role in our life. Immensely important role. And intimate relationships are one of the most important relationships because a lot is happening in that space. A husband, wife, partners, okay, work relationships, all of these relationships are very important. How satisfied I am with my relationships, it is a big question because it will affect the way I am viewing the world, the way I am working, the way I am taking care of myself. A lot depends on the relationship. And if I feel that I am in a toxic relationship, a lot of people do not understand if they are already in a toxic relationship. And they have a lot of unspoken needs in a toxic relationship, right? A toxic relationship will never fulfill all of your needs. Understanding if I'm in a toxic relationship, what is exactly happening? What is my space? Am I getting space to express? No. Can we have, can you please mute your, this thing, please? Yeah. So it is important for us to understand the people that we are with, the people that we are surrounded with. It is a very, very important saying that, okay, the kind of people you are with, they create you, the company that you have. If you're listening to something 24/7, and if it is negative, then you are going to develop that mindset. You're going to develop those feelings and those behaviors. But if you are with people who are encouraging, okay, who are supporting, saying positive things about life, then that is the approach that you will develop towards life. Okay. So the social atmosphere that we are in actually makes a lot of difference. And the personal needs, what do I value? This is a big question. When I ask people the strengths and weaknesses of their best friend, they can write a book on it. They will give me 10 pages. Oh, this is good about her, that is bad about her, this is that. But the moment I ask them, what are your strengths and weaknesses, they look at me blank, because they have never given a thought to what is it that I value, who am I, what are my strengths, what are my weaknesses, what are the things that I prefer in life, because we are in a very automatic mode. We are preferring the things that we have been taught to prefer. Okay, so it is important for me to know myself. Know thyself. Know thyself is one of the most important things for us to do. And then how can I incorporate more of what I prefer in my life? Okay, given that it is a nice thing to prefer, okay, I'm hoping that we all prefer positive things, and how to incorporate that in our life. Now, these are certain questions that I would want everyone to have. Okay, a list of these questions, they will help you understand the unspoken emotional needs that the person is going through. What are the areas to assess? These are, if you can see the areas, these are the areas that you need to assess: security, control, privacy, intimacy, achievement, attention, meaning and purpose, community, and status. These are the areas that you will assess. How will you assess these areas? You will have open-ended conversations, questions. Okay. How secure do you feel? If you look at a person and if you feel that person is very fidgety, okay, the person is not feeling safe, the person is very anxious, on the edge, sitting on the edge of the table, sitting on the edge of the chair, not sitting relaxed, okay, getting very hyper alert, hyper vigilant, eyes always searching for what is there, am I safe? So you will ask that person, how secure do you feel in general? How secure do you feel at home? How secure do you feel at work? How secure do you feel with your family? How secure do you feel with your partner? How secure do you feel in a particular situation that the person has spoken about? Okay. Then the next is how much in control the person is feeling. If a person is completely feeling that I don't have any control over my life, okay, then you will not be able to get through that person. You will not be able to make any progress with that person. Okay. So we have to understand what is the amount of control that the person feels in his or her life, which is also pretty much unspoken. It is not spoken. Then privacy. Okay. When I say privacy, I don't mean like having a huge place to yourself. Privacy is something very simple. For some people, privacy is just having 15 minutes in a day where you're sitting relaxed and having your tea. Privacy for some other people will mean that I need to have a room for myself. Privacy for some people would mean something else. So, two things we have to understand. What is your definition of privacy? Okay. And do you feel that your privacy is valued? Okay. A lot of women will come with this, that sometimes I feel my privacy is not valued. Okay. Of course, men will also have the same issue if they are living in a space which is not, um, it's very crowded basically. Okay. But privacy is important, so that I at least have this space where I can sit and just maybe 10-15 minutes of silence also, if I can have, right? Next, another very important thing which is always unspoken is intimacy. Okay. And intimacy is not just with your partner. Intimacy is with anything. Intimacy is with a pet. Okay. Intimacy, it is important for us to understand the intimate relationships that the person is going through. Okay. It is important to have some intimate relationships in your life, even if there is no other person but just a pet. I know of somebody right now who has survived suicides and everything just because of her pet, of the cat that she lives with. Okay. And that is one of the most beautiful intimate relations that she has with that particular pet. Okay. However, a life lacking absolute intimate relationships, no intimate relationships, okay, then there is a huge void and emptiness that is there. And that is again unspoken. We have to probe into that area. We have to ask them, okay, which are your intimate relationships? With whom do you feel more comfortable? Okay. The next is about achievement. Sometimes the focus becomes too much on the things that we have failed, okay, things that have not worked out for us, which is sad because there is always something that has worked out and there is always something that has not worked out. But in the moment of an intense situation, an intense feeling, our focus goes only towards the things that has not worked out, the things that we have not been able to achieve, and we forget the things that we have achieved. We need to help the person bring about this sense of achievement through small things. Okay. There's a very beautiful technique called ego strengthening technique. You can write this down. Ego strengthening technique. It helps the person sort of feel confident about themselves, look at their achievement from a positive perspective, and accept those achievements. Now, here, if the person feels that I have no achievements in my life, then the person is going to, then there is again a huge unspoken need, a void where I am feeling I'm good for nothing, I'm useless, I'm a big failure, I have not achieved anything. Okay. And you can see that in the person's face. You will be able to see that. Okay. Next one is attention. Attention meaning what? Attention meaning not the attention span. I'm not talking about attention span. I am talking about some person is there to attend to me, not like on a regular basis. It can be a best friend, it can be a sibling, of course, it can be a partner, it can be parents, but a place where you feel you are attended. Okay, it can be a counselor. Okay, someone who's paying a little bit of attention to you. Doesn't that feel nice when there is somebody who's paying a little bit of attention to you? Okay, and if there is nobody, okay, can we have the mics on mute, please? Yes. So when we feel that there is nobody who's paying attention to me, and there is nobody so when I feel that there is nobody who's paying attention to me, then I feel that nobody's caring for me. There's nobody who cares for me. And that is a very sad feeling that nobody cares for me. Then there will always be this unspoken need for attention, unspoken need for care. This unspoken need for care and attention, it intensifies and becomes, okay, attention seeking. If it is not fulfilled in the way, then it becomes attention seeking. Then I'm trying to seek attention from here, seek attention from there, seek attention from every possible place. Okay. Now, the question that you can ask is, how seen do you feel? Who are the ones that pay most attention to you? Okay. We are inquiring about these areas of your life because these are the areas that can be mostly unspoken. These are not spoken. Okay. Next is meaning and purpose. Oh my God, I cannot emphasize this enough. I cannot emphasize this enough. Without meaning, without purpose, you are lost. You are lost. You can be the wealthiest person, but if you feel that I am not having a meaning and purpose, then you're basically very poor. Okay, the person with the most meaning and purpose in their own psyche, in their own head, is the most wealthy person, because you'll be able to live long if you have meaning, if you have purpose. Even if you don't have a single penny in your pocket, you will be able to live it through because you know that you have a meaning and you have a purpose. But the moment you feel, I don't have a meaning, I don't have purpose, then it does not matter all the material wealth around you. Nothing matters. Okay, meaning and purpose to me becomes one of the most important things. You can combat everything if you know that I have a meaning and I have a purpose. So one of the most important things about counseling is to prepare meaning and purpose for the client. And the next is community, being a part of something social, being a part of some group, being a part of something. Okay, see, this is evolutionary. I don't know if you all are aware of evolutionary psychology. For people who are not aware of evolutionary psychology, please go ahead and check what is evolutionary psychology. Evolutionary psychology is how human beings have developed, how they have grown through evolution. And for human beings, biologically, it is important to be part of something, part of community, part of a group. Okay. And if I'm not part of anything, again, despair comes in. Okay, worthlessness, failure, all of those things they come in. Okay, so we need to be part of something. So here, what are the questions that you ask? Do you have friends, social group that you are a part of? How often do you feel lonely? This is also very important. What are last is status. Now, status, I don't mean that you need to have a visible status. A lot of statuses are unset. Okay, a woman's status in a family who is taking care of the family, who is a housemaker, her status is different. Okay, however, sometimes that status is so much greater than the status of somebody working, because that is the status that the family is giving her, that she is managing the house and everything so well. Okay, so her status is fine. However, sometimes people lack their status. They don't know, where am I? Okay, I'm a part of this family, but what is my status here? We ask, no, everybody who has ever been in a relationship, if we are not sure of my status in the relationship, don't we ask the partner, my status kya hai? Okay, are we in a relationship or not? So status means a lot of different things. Okay, and if I am not sure of my status with something, then that creates a lot of confusion in the head, and again should be a part of a lot of unspoken needs. Okay, any doubts anybody has till now? Any questions that you want to ask? Nobody? Okay, so then I will continue. Okay, because there was quite a few things that I wanted to discuss, and 1 hour is very less to put everything in. I would love for all of you to come and join the other courses where you get to understand all of these things better. Okay. Now, what we understood by till now was the 9 emotional needs. These are the basic emotional needs where you will see a lot of unspoken aspects. Okay? However, life can be divided into different parts. Life is not just one thing. A lot of people will look at life and they will feel that, oh, life is working, just work. Life is just family. Life is just money. Okay? No. If in your life only one part is doing really good and the other parts are not doing really good, then soon you will deplete in energy. Okay, it's like different parts of your life are working together. You cannot have only your heart functioning and the rest of the body not functioning. Okay, you cannot have only your liver functioning and the rest of the body not functioning. All of the parts of the body have to function together for a well-functioned body. The same for life. All parts of the life have to be looked into, understood, and given some importance for life to happen, in a smooth manner. So what are the different parts of life? Now see, physical health, of course, we all know how important physical health is, right? Then we also understand how important financial health is, financial life is. We also understand what is occupational life, careers, and all of this. These 3 things we understand. But apart from these 3 things, there are different things that you need to look at. How is your emotional life? People will be like, what? Is there an emotional life? Yes. The emotions that you experience maximum time, they sort of make your emotional life. There is this very nice thing. Go on a chat box on WhatsApp. Go to the emoji part and see which are the emojis that you have used too much for the past few days. That is a small indication, as in what have you been feeling. If you have been using the crying emoji a lot, ask yourself, why am I crying so much everywhere? If you have been using the heart emoji a lot, ask yourself, am I really feeling that, or am I just putting it up? Emotional health is important. Emotional quotient is important. Emotional management is important. If you're doing physically really well, you're doing financially really well, you're at work, but if you don't have an emotional system, if your EQ is very low, if your emotional management systems are very low, then you will not be able to sustain your success. You will fall down with it. Okay, the same goes for intellectual aspects of life. You need to have an intellectual aspect. Dementia, problems that happen at the later age of life, they happen more when we do not use the intellectual part of us. Everything gets monotonous. We're just doing things. We're doing things. It becomes automatic. And when it becomes automatic, there's no exercising of the brain that is happening. So intellectual life is important. Watching good movies, reading good books, having intellectual conversations, having debates, all of these things are fine. Okay, that creates your intellectual life. Spiritual life. By spiritual, I do not mean religious life, or okay, even if you're an atheist, to me that's also a spirituality in its own way. Okay? I do not mean just one idea of God or something like that. I do not mean one religion. Spirituality is very different. Spirituality is just how you connect with life and the people around you. Okay, that is spirituality. Being able to see as everyone around you as equal. So we have spiritual practices. Meditation can become spiritual practice. Yoga can become a spiritual practice. And if you are a religious person and you have your own religious practices, that is also absolutely fine. But a life with absolutely no spirituality, that causes anxiety and can cause depression. Okay, so understand it is important. Environment, physical life, physical environment. People have stopped going out in the environment. Okay, it is important for us to go in the environment, sit in the environment, experience the environment, the nature. By environment, I mean nature. Okay, being involved with nature, because that is the basic for human beings. Living in apartments and buildings is not natural. Okay, people, it's not natural. We came from the place of entirely being one with Mother Nature, where we were living with Mother Nature, and all of a sudden we are not. So we need to make sure that we go out and we are still with nature. Financial life, we understand. Occupational life, we understand. And then we come to social life, like we have already spoken. We need to have a social life as well. Okay, so you can take these points and use this. Okay? So the first thing you do to understand the unspoken needs, listen and not hear. Hearing and listening are two absolutely different things. Hearing is what? I'm in this room, the fan is on, so I can hear the fan, but I'm not paying attention to it. I'm paying attention to what you are saying. So I'm listening to you. You have to listen. When you're listening, you are not thinking anything. You're just listening. When you're listening, you're not thinking of how am I supposed to respond to this? No, listening. Practice listening to your own self. Practice listening with others. Okay, identifying and addressing resistance. If your client is resisting talking about something, someone, some place, some situation, then there is something unspoken over there we need to understand. Okay, we focus a little bit on that. Okay, what is the resistance all about? Okay, when the client is avoiding certain topics, people, places, some conversations, probe into that a little bit more nicely. Okay, don't make the client feel threatened, like you're being cornered. Not like that. Okay. Sorry. So the next one that we need to understand is, what does the client bring up so often more? What is the client talking about more and more? You need to understand, if the client is talking something more and more, it might feel a little trivial to you, but understand the context. Why is this person being spoken about so much? Why is this event being spoken about so much? Probe a little bit more into it. Ask more questions with respect to it. Something might come up, okay? There's a reason why the client is bringing it up so much, either consciously or unconsciously. Now, the most important thing to do is observe body language, facial expressions. There has to be coherence. So when I'm saying that I'm happy, I need to look happy. My shoulders are all drooped and my face is all down, and I'm saying, yeah, I'm happy. That does not make sense. There is no coherence between what I'm saying and what you can see. So you have to bring that up. You have to see what the client is saying and what I can see in the client. Are those two things matching? If those two things are not matching, then there is something unsaid over there. Okay? Understanding when the client is silent, allowing silence sometimes. Don't push. Okay, if the client is silent, that's fine. You tell the client that I am there. Whenever you feel like speaking, I am here. Okay, you take your time. If you're feeling that you cannot talk about it, you can write down. Okay, if you feel you don't want to talk today at all, not a problem. Okay, you have to respect the client's silence, because the client is trying to understand how to talk to you. Okay, understanding your own unspoken needs. We have spoken about it right now. I'll not go again deep into it. Observing and not just seeing. Like I said, listening and not just hearing. Similarly, I say observing and not just seeing. Observe, observe, observe the face, observe the eyes. Okay, you can read up on body language. It will help you understand so much. Always ask open-ended questions. Never ask close-ended questions. And use all of the information that you have gathered. Then create a summary for your own self. Put it forth in front of the client, and you can tell the client. You will learn to summarize in CBT. Then you will ask the client that, I am feeling that there is something that, you are not expressing. I would like to understand if you're not expressing because you don't want to talk about it, or you are not expressing because you yourself are feeling confused about it. Okay, summarizing is very important. When you summarize, your client understands that you have understood. Your client understands that you have observed, and the client feels much more like I am in competent hands, and the client will talk to you a little bit more. Okay, so that was it for the unspoken needs. Okay, this is what I can do in an hour, and I know that it is less. So, because there's so much when it comes to unspoken needs. There's so much when it comes to unspoken needs, and for people who have actually sat in front of a client and looked into their eyes, you will know. You will know what are the things that is unspoken. I want all of you to try one thing today. Okay? Can we have your? Thank you so much. So, I want all of you to go in front of the mirror. Am I audible to everybody?
Yes, ma'am.
Yes, no,
Yes,
Yes,
ma'am.
ma'am.
Yes, yes.
yes, no, yes, no. I'm audible, right? Yeah. I think it got paused a little bit. So I want all of you guys to do one thing today. You have to spend 10 minutes looking into the mirror, sitting in front of the mirror, just looking into your eyes. Can you do that? Without crying, that is. In so many different situations. And whatever comes up, something negative comes up, it's okay. We are all human beings. Okay? Nobody is perfect. Nobody is perfect. If you're not perfect, it is just because you're a human being, just like me, just like everybody else. But you need to know how to sit in front of the mirror, look into your own eyes, Just look into your eyes and talk to yourself. Ask the person who's gone through so much. Just ask the person, how are you feeling right now? Okay, what is it that I haven't noticed about you? What is it that I have ignored about you? Then we do this small exercise, okay, before going to sleep. Okay, okay. Thank you so much, everybody, for being here today. I hope you enjoyed the class.
Thank you.
I
Thank you, ma'am.
thank you, Marjorie.
Thank you, ma'am.
Vartan.